So hello everyone, welcome to the Environmental Research Seminar. I am Sungkyun Park, a faculty member in Epidemiology and Environmental Health Sciences. So this seminar series is sponsored by Michigan Life Stage Environmental Exposures and Disease Center, M-LEEaD. So today, we have a wonderful environmental epidemiologist, Dr. Sara Adar, who is an associate professor and associate chair of epidemiology at the University of Michigan. So I will give you a brief introduction about her. So Dr. Adar started her environmental engineering degree from MIT, and then she switched her career to public health, and she did her master's at Johns Hopkins and a doctoral degree from Harvard School of Public Health. So she focused on human health effects of air pollution with an interest in studying intervention strategy, which is the topic for today, and improve health. Dr. Adar's research contribution has been recognized with awards from the American Heart Association and the International Society for Environmental Epidemiology and the National Institute of Environmental Health Science. So before I turn this over to Dr. Adar. So please, if you have any question during the presentation, you can put your question to Q&A, and then after the presentation, we will follow up. So please welcome Dr. Adar.
Thank you so much for the introduction, and thank you so much for the invitation. I'm really delighted to be here with everybody today to share a little bit about our work. And I had an especially fun time creating this new talk for you guys. Really, as I was thinking of our conversation that started with Dr. Corey Ziegler's visit, and thinking about, how air pollution is regulated and sort of the context in which science feeds into that policymaking. And during that session, if you were there, I talked a little bit briefly about how I'd like us all to be thinking about our science, and how we're selecting topics that might have the largest impact on really public health. And so that's a theme that I've tried to sort of take through my talk today, and I hope you'll see that. So first off, I'm just starting us with an image of LA. This is a place that I was born. It's a space that has really high air pollution levels. And so it really began my interest in environmental health, as Sungkyun was telling you, started really in college as an environmental engineer. And then later, I started to start researching air pollution, both in my master's degree and then in my PhD. And as I'm thinking back, you guys will all have this time in your life when you realize that you're a lot older than you realize you are, you think you are. And it occurred to me, that I've been doing this quite a long time already. I started doing research really in air pollution in the mid to late 90s. I got my PhD in the 2000s. Or started in the 2000s. And really what occurred to me is at that time, really some of the foundational research on air pollution was pretty brand new. So it had just been published in the previous 5 to 10 years before. I was really excited. I got to be working with many of the leaders in the field who had done those really core papers that launched us on sort of this, long trajectory of studying the impacts of air pollution on health. So when I began studying air pollution, there were still a lot of questions that had to be resolved. So, for example, at the time I began, we knew that air pollution could trigger hospitalizations, it could trigger deaths. But we knew that people living in places with higher air pollution had, higher rates of death and higher rates of disease. But what we didn't really know was whether or not, for example, it was just a series of triggering events. So whether or not, it was really all short-term impacts, or whether or not it was actually long-term development of disease that happened. And so sort of looking at this graphic, this is a graphic of papers published per year on air pollution and health. I would say that since that time frame, right, like, so really in the 2000s, 2010s, we were making a lot of progress filling in the gaps of our understanding. We now have a really good understanding that particles in the air, so they're incredibly small. I have them here. These black particles, the PM10, particulate matter less than 10 microns per micrometers, and PM2.5, which is less than 2.5 micrometers. They're teeny tiny, and we know that those are able to get deep into our lungs. They can actually trigger autonomic nervous system response. They can have inflammation and stimulate vascular changes and all kinds of things that ultimately lead to various health effects. So many of the really well-studied ones are respiratory outcomes, cardiovascular outcomes, but all of these things ultimately lead to poor health and advanced death. In fact, right, the epidemiologic and toxicologic literature is really rich and has consistently linked air pollution with worse morbidity and mortality. So that really the WHO and these global burden of disease projects have put outdoor air pollution as like one of the top contributors to morbidity globally. So here is a graphic, this is from the 2019 data from IHME, where they're showing that air pollution is the 6th leading cause of disease globally. It's also been estimated to cause over 4 million premature deaths each year, which, just to give you context, that is about the population size of Los Angeles. So we're talking about, concentrations in ambient air around the world, basically contributing to the population size of Los Angeles dying early each year. Some of you might be surprised that air pollution is so important. It seems, sort of trivial in comparison to hypertension and smoking and things like that. And I just want to remind you, it sounds sort of silly, but we're all obligatory breathers, right? From the day we are born to the day we die. And so when you think about population burdens, air pollution really clocks in quite high because we are exposed throughout our entire life course. It also is not all that surprising, given that air pollution causes inflammation and oxidative stress and all these things, that you can experience a whole host of different health outcomes, again, ranging from the lungs to the kidneys to the heart to all different things, and even in the brain. So that brings me back to this slide, right? I think it's actually pretty notable. I was on a call yesterday with John Samet, who reminded me of this sort of concept. But, we're talking about 8,000 new papers per year. This is what I got when I did a search in PubMed on air pollution and health. Really, there is compelling evidence. These are papers that the vast majority of which are saying that air pollution is bad for health. I think we know that we should be reducing exposures. Governments have policies in place. And yet we're still publishing this huge number of papers. And so I just wanted to come back to this space of thinking really carefully about when we're publishing in a field. Early on, we still needed a lot of questions, answers. And as the field is progressing, right, the key questions that we have are changing. And so that's really one of the focus of my talk today, is just sort of thinking, and it's not just air pollution alone, right? This is thinking about, how do we best use our talents, the limited resources that are out there for funding, to really push forward public health, and how do we improve things? And so in doing that, right, I would argue that we want to keep this sort of foundational principle in mind, right? Is like, what is the research that we can do? What are the questions that we can ask that are most likely to improve health, either because they're sort of validating some sort of change or intervention that you might be able to do. They're developing data that can be used to create a new intervention or prioritize interventions? Or is it, because you're actually generating data that's going to change people's minds, right? So we heard from Dr. Ziegler's talk that there's still folks, even though there's this many papers on air pollution, who are still skeptical. And so thinking about how can we really do our research in such a way that it becomes the most impactful version of science that we can do. So with that notion in mind, I've spent, a lot of my time more recently trying to understand more the effectiveness of interventions, and thinking about how I can answer questions that's going to, really guide actionable choices needed to move the needle. So when I'm thinking about that, like what are interventions, I thought it might be helpful just to really quickly go back to the old-fashioned, industrial hygiene principles, and think about this hierarchy of controls. As you can imagine, the absolutely most effective interventions are going to be the ones that just remove toxic sources altogether, or they substitute out those sources for other, less toxic sources. Then you could imagine reducing emissions somehow from sort of these toxic sources. And finally, something that can be effective, but has the least efficiency because it's really done on that individual level, is thinking about, okay, well, if the society isn't changing, how can I go about protecting myself? And so thinking about personal protective strategies. So with this overarching framework, I am going to try and show you some research that, I and my team have been conducting on air pollution and health, really trying to target various pieces of this pyramid. So the first bit that I'm going to talk about is interventions and plans to try and eliminate or reduce emissions from traffic sources, and see the benefits on health. So first off, well, why am I talking about traffic? Well, in the United States and elsewhere in the world, traffic is one of the leading contributors to high air pollution levels in our community. And that is not destined to change all that fast. So, here in the United States, we really love our cars. I think the latest estimates I've seen is that by 2040, we expect to have something like 2 billion vehicles on the road, which is sort of mind-blowing when you pause and think about that. As a large contributor to our air pollution levels, it's not surprising that there is a pretty big literature linking these exposures to poor health. It can range from respiratory problems, again, all the way to, things like pregnancy outcomes. And I've spent a lot of my career actually looking at traffic as a source of poor health. In my opinion, some of the most exciting research that I've done in this area and sort of in the field is thinking about children as susceptible individuals in our society to the impacts of these exposures. Kids, as many of you guys know, are just developing, so their lungs are still growing. They also have a much larger burden of air pollution because their ventilation rates per body size are higher than for adults. And so we think about them in terms of, we think about them in terms of, their exposures, both at home, but also in commuting to school. So it turns out that from a traffic accident perspective, school buses are still by far, the safest way for us to get our children to school. But when you're thinking about air pollution, our school bus fleets are not that new. And many of those vehicles have pretty high exposures on board. And so kids are getting a pretty high share of their daily dose of particles inside many of these old buses. Now, the good news is that as buses have been being rejuvenated and new versions are coming out, there are technologies that are really effective in reducing exposure. So, for example, there's something called diesel oxidative catalyst, which is something that you probably think of, which is used to really clean up the tailpipe emissions, which is probably what many of us think about as being like, why a bus might be problematic and stinky. It basically takes the exhaust out of the tailpipe and continues to oxidize it until it comes out as a cleaner stream. Now, the other source of pollution that many people do not know about is from the crankcase. So this is basically the engine block, and unspent fuel and like lubricating oil and things like that can burn and make a bunch of pollution. Now, the way that the traditional buses used to get rid of that pollution is they would pass it out through the bottom of the bus through what was called a blow-by tube. So there was like, just take all the what I call schmutz in the air and pass it out the bottom of the bus. Now, what we found in doing research in Seattle is that the engineers weren't exactly thinking about the kids and where those pollutants might go when they designed where to put the tube. So those tubes are very often under the door, which means that when the driver stops and opens the door to let kids on and off, much of those emissions were coming straight up and into the cabin air. So you're getting a high level of self-pollution from that crankcase, again, kind of coming out the bottom of the bus and then through the door. So there's now a system where you basically blockade off that crankcase and you can reburn that fuel and make it, or the oil and things like that, so that it's cleaner. Now, these technologies were shown to be really effective inside of lab settings, but they hadn't been tested on understanding the impacts actually on true children's exposures as they rode the bus to school, as well as their health. So one of my first projects in intervention research was looking at the impacts of replacing older buses with these new technologies. And so out in Seattle, when I was a postdoc, we conducted this natural experiment where there was a local clean air agency that had provided 2 different school districts money to replace or retrofit their buses with cleaner technologies. So we basically went out, we sampled the air inside of the cabins and showed that we did this like basically before, during, and after these switches, and showed that indeed with the clean air technologies, you could drop the concentrations of particles inside those buses quite dramatically. So the DOC is a diesel oxidative catalyst, the crankcase ventilation. B20 was a biodiesel that didn't actually wind up showing as much, and ULSD was a clean sulfur fuel. Now, we also were tracking the health of 400 kids before and after these switches as well. And notably, we found that installing these DOCs, installing crankcase ventilation systems, and switching to ultra-low sulfur diesel was goodness me, this is like a weird thing that it's going away from me, but I'll keep trying to rein it in. So we found that that switching to ultra-low sulfur diesel was associated with reduced inflammation in the lungs, as is shown here, and it was especially true among asthmatics. And then in sort of a secondary outcome that's really important for kid learning, it's actually really important for working parents and employers of working parents, we also found that when the kids were riding buses with clean air technologies and fuels, there was much less absenteeism in those kids, and especially among those kids with severe asthma. So this was a really important finding. We could see that actually, sampling individual kids, sampling individual buses, we saw that these interventions improved their experiences. Importantly, though, the EPA has also, so that was just this localized area in Seattle, but the EPA has also been providing funds to schools around the nation in a much wider reaching program that's called this, school bus rebate program. It's part of the Diesel Emission Reduction Act, or DERA. And starting in 2012, they were offering allocations of money to school districts that applied for funds to replace their buses. Now, they didn't have enough money to replace all of them. And so what's crazy cool from a research standpoint is they wound up implementing a random lottery among the applicants to see who would get the money. So as you can imagine, right, like a random lottery, that's so cool. It's really the holy grail in terms of epi studies and thinking about, how we can really try and get at causal impact. So my former student, Meredith Petty, who's now my postdoc, she and I got funding from the Health Effects Institute to try and understand the effectiveness of this program on absenteeism. Actually, we were also looking at school performance and health in the communities at this national scale. So specifically, what I'm going to show you in this talk is whether or not those districts that were randomly assigned the money, so those districts that won the lottery experienced increases in their attendance after getting that money that were not observed in those districts that had lost the lottery. So really briefly, what do we find? Well, first off, it was a pretty big sample. So we had almost 2,500 losers of the lottery that we analyzed and 400 winners. Importantly, the distribution of characteristics among winners and losers was indeed similar, suggesting that it was a random assignment of who got the funds. So we ran models. We did do some adjustments, but again, it's a random, random controlled trial. So that makes, our inference a lot stronger. And what we found is that when we ran these models, we saw that there were mean increased attendance rates among the lottery winners that were not observed in the losers. So on average, a school district that has about 10,000 students would see about 6 additional students in class every day. So it doesn't sound entirely huge, but if you think about, right, that's just for a district that's having some 6 additional students in seats every day, it winds up actually being a pretty big impact. Now, one thing I wanted to point out is that we had to do this analysis at the school district level, right? So it's really an ecologic design, meaning that our attendance rate is actually reflecting the entire district and not just those kids who are riding the buses. And so we tried to, do some sensitivity analyses to get at, that association for places where there were more kids on those buses. And so what we did is we stratified our results looking at the impacts, of winning the lottery among, groups that have, or districts that had a much higher fraction of students riding the replaced buses. And sort of as you expect, right, the more students who are riding those buses, the bigger impact we see. And so in those districts that had, a much higher fraction of their student bodies riding those replaced buses, we saw that it was, closer to 14 additional students in their seat every day. The other thing that we did is we know that not all buses are equally polluting. And so really the oldest buses are the most stinky. Those are the ones that, both based on regulation and also really just technology at the time, are the ones that are most polluting. And what we can see is when we restricted our analyses to really understanding, is it the buses that were older than 1990? So we're talking about really old buses here, right? Versus 1990 to 1999 or 2000 and newer buses. The benefits that we saw in replacing these school buses was really seen among the dirtiest buses. If you take a 2000 and newer bus, which is pretty clean already, you didn't really see much of an impact. But if you start replacing the 1990 buses, you start replacing the 1990 to 1999, you get a much larger impact per bus. And in fact, one of the things that we did is we projected the benefits of this program to the entire United States, right? So on the left, what we have is an estimate that there were an additional 350,000 days of attendance that happened due to this program as a whole. And that's on an annual scale. So that's just for 1 year, right? So the EPA's money bought us effectively 350,000 more kids in attendance at school during a year. So that's a pretty big impact. The other thing that we wanted to ask is, okay, we see that the oldest buses are the ones we should target. What would happen if the EPA were able to find the money to go out and replace all of those old buses, like leave all the 2000s and laters alone, but just go out and replace the buses from 2000 and earlier? And what we saw is if that money could be found and you could just magically, or you could magically go out and just like replace all of the oldest buses in the United States fleet, you would see 1.3 million additional student days of attendance every year, right? So those are really exciting findings, really impactful findings, and hopefully to hit the press very soon. Okay, so those findings were restricted to school buses. And another former student of mine, so Paula Filigrana, who's now in New York City, she asked a slightly different question that was more broad. So what she was asking was whether or not you could really just change the fleet as a whole, and whether or not you could change the way that people use their cars to improve health. And what's interesting is rather than doing a natural experiment, which is like what I did in the past 2 studies, she asked this hypothetical question, sort of in the like counterfactual world, like what would happen in a future world if instead of, everybody just proceeding as they are, 35% of our vehicles became electric vehicles, right? So like basically people traded in their internal combustion engines, got electric vehicles, like what would happen there? So that's her scenario 2. And then in a third scenario, she asked the question, what would happen if not only did people change out their cars to, less polluting locally cars, but they actually also stopped driving. So if a trip was less than 1.5 miles, half of the people started using active transit and walked. What if, trips that were basically 1.5 miles to 5 miles, half of those trips were replaced by people on bicycles? And so she's asking that question. The way that she did that is she ran chemical transport models. So she ran something called R-line and moves, really to estimate the concentrations in communities. We did this in Seattle. So what would happen to the concentrations in communities given her, business as usual scenario? So what would happen if things just kept on keeping on versus what would happen in her 2 alternate universe scenarios with the electric cars and the electric cars plus active transport. Then what she did is based on the concentrations that she predicted under those scenarios, she did a comparative risk assessment where she basically used published risk factors for mortality and also asthma hospitalizations to understand the change in burdens for, basically due to air pollution, changes in physical activity, and also traffic accidents from those scenarios. So this is what she found. Basically, this is all in comparison to the business as usual scenario. So what happens if we just keep on? What she found was that in total, the city of Seattle, which experiences about 4,000 deaths per year, could have 11 fewer deaths each year averted, just due to switching to electric cars in the current fleet. So even if the same number of cars were on the road, 11 fewer people would die each year just due to the air pollution alone. Notably, and sort of interesting that sometimes, our own piece isn't necessarily the biggest one, right? Switching to active transit not only ups the benefits from air pollution, but actually now you have all these people who are exercising and getting physically healthier. And so that scenario with the active transit also had benefit in terms of physical activity, and the benefits got closer to about 70 lives, premature deaths basically averted each year due to switching to electrification and active transit. And similarly, she showed benefits for reducing asthma attacks. Okay, so that is just a really brief rundown of a few different studies that we did trying to understand, the health impacts of either removing certain sources or substituting them or trying to really, reduce the emissions from those sources. And what we see is that modifying the vehicle fleet, should certainly translate to tangible population benefits. So those results were all for traffic. Again, I think I made, an argument that it's an important source based on what we see in the literature. And in part, we know that traffic is bad for you because it's received a lot of attention. And I would argue that some of the other sources that contribute to our air pollution have received some less scrutiny. And yet, you can imagine that knowing if different sources have the same health impacts, right, can have really obvious implications for designing interventions. And, it's pretty important given that our national ambient air quality standards are based on total particles overall. So they don't differentiate, what kind of particle it is, even though different sources generate different kinds of particle. And so in this next bit, I'm going to highlight some research that we have going on as part of this Gateway to Global Aging study that actually has many different objectives, our Gateway to Global Aging project. But the piece I'm going to focus on here is, really studying these different sources in a way to try and provide insight into perhaps, the most efficient strategies for intervening on particles and improving health. So really briefly, the Gateway to Global Aging project is a big study funded by the National Institutes of Aging. From the air pollution side, it represents harmonization across 8 different nations, each of which have nationally representative cohorts of aging that have been harmonized, which is super cool because their outcomes have all been harmonized. So we can really understand, we're getting similar information in these different locations. We also have been harmonizing our exposure assessment. And so we teamed up with Dr. Gavin Shattuck and his former student, Matt Thomas, who really are the folks who developed the estimates of air pollution for the whole world that are used in the Global Burden of Disease Project by the WHO. These estimates are leveraging satellite data of the aerosol optical depth. They're leveraging chemical transport models. They're leveraging, characteristics of place. And basically modeling exposures at a 1 kilometer by 1 kilometer grid, again, for everywhere. Here I'm just showing you for the Lassi study, which is our project in India. Now, the other cool thing that we brought to the Gateway is we've brought these estimates from Mike Brower's team, where him and Aaron McDuffie and some other people basically they gathered emissions data from the entire world. They then ran these chemical transport models where they removed one entire source at a time. And what that allowed them to do is to understand what fraction of PM is coming from each source. And what's super cool about it is it's not just those primary emissions, so like what's directly released off of that source, but it actually takes into account all of the chemical reactions that are happening in the air and the secondary formation. And so it really gives you this great estimate of the burden from a particular source. Like what would happen if tomorrow I could just turn off energy production from coal? I just turn it all off. What would happen to the particle levels across the world? And these estimates are varying by place, right? Because we know that, for example, the coal-fired power plants are not equally distributed. So you can actually see the impacts to each location. So, all right, we have harmonized outcome data in these different nations. We have harmonized exposure estimates in these different nations. We have started our work primarily in these 2 cohorts. We're also working again on the other 6, and the counts keep going up. So we have more and more folks participating with us. But really, I'm just going to highlight for you today in this talk data that comes from the Health and Retirement Study. So this is a project that is run by ISR here at University of Michigan. It's an open cohort design with follow-up every 2 years since 1992, with sample replenishment to basically get the cohort at about 20,000 people. And so, there's been actually more than 20,000 people in that study because they keep recruiting new folks as the populations age. We also have data from the Longitudinal Aging Study in India, or LASI. And that study, they're actually about to launch wave 2. But that in wave 1, they've sampled from 70,000 people, again, nationally representative in both surveys across the whole countries. And that exam was in 2017 to 2019. So just for the purpose of this demonstration, I'm going to talk briefly about the cognitive aging. So, there's evidence that air pollution can actually go up through the olfactory bulb right into your brain. Systemic inflammation and oxidative stress and everything also impact your brain. And so we were looking at incident dementia in the Health and Retirement Study and cross-sectional measure of cognitive performance in LASI. So statistical modeling, really briefly for the HRS, when we were doing incident dementia, we used time varying Cox proportional hazard models. For cognitive performance, we were running, linear regression models. We have really detailed adjustments because we have so much information on people and where they are. We're adjusting really detailed for time and age, demographics, socioeconomic status. We have a lot of information on that. These were actually surveys designed by economists, so we have really good data there, as well as characteristics of area being urbanicity, region, and place. We also have, clustering information that we included in that. And we did single pollutant models, and then we also adjusted for total PM because we didn't want, the total, which is often tracking with each source. So the first analyses I'm going to show you have been run by Boya Zhang, who's one of my PhD students here at U of M. This is again an HRS. We're talking about 30,000 people who were eligible for follow-up over about 10 years. This is a map of the concentrations by different source types in the United States. You can see that they're tracking differently in place. Many of them are overlapping, but there's also sort of key differences. Most notably, right, the windblown dust and open fires are really much more prevalent in the West, whereas many of the other sources you're seeing sort of in our region in the Midwest and going into the East. So really briefly, what I'm showing you here are the hazard ratios per interquartile range in single pollutant models for particles from different source types. So what you can see is like across the board, PM is pretty associated with greater hazard of incident dementia. The places that you really just don't see anything that's notable is the industry, non-coal combustion industry, as well as windblown dust. But just when you're looking at single pollutant models, you pretty much see, I guess, energy development is also a little bit weaker, but otherwise you're generally seeing associations with particles. When we adjust for basically particles from all other sources, but the one you're looking at, the strongest associations that we see remaining are for the total PM, which is, that's just the overall. And then for agriculture and open fires, we're seeing a little bit with traffic, but those are blunted by adjustment by other sources. That's kind of interesting because it's showing us, that agriculture and open fires seem to be important. So let's now take a quick look at India and see how those results are holding up there. So these are analyses that were run by Jen D'Souza, who's also in my group in collaboration with our colleague, Jin Cookley. Again, this is, a pretty big cohort. So it was about 62,000 folks that we had data that we could look at. Again, this is a single pollutant model, but this is now cognition or cognitive performance. And so here we're expecting with higher levels of air pollution, we'd see worse cognition. And so that's why you're seeing all the associations on the left-hand side of the graphic. Again, you can see that PM from all the different sources and overall, with the one exception of windblown dust, right, are associated with worse cognition in the cohort, even after our rigorous adjustment for all kinds of individual and area level factors. When we put them into models together, so again, adjusting for total PM mass from all other sources, we're again seeing that agricultural waste burning, so that's like the crop stubble that they burn, and open fires are still one of the stronger associations with poor cognition. Here we see a bit more showing up for non-road transportation, again, maybe the suggestion of things with energy coal, but it's kind of interesting that we're still seeing pretty similar associations there, both for agriculture emissions, again, open burning, and perhaps to a lesser extent, traffic associated with worse brain health in these two very diverse settings. Okay, I know my time is getting close, so I'm just going to jump to the final piece of this, which is thinking about effectiveness of sort of personal protective measures, so how you might modify your own personal levels. In this part of the talk, I'm highlighting a study that we did a few years back now in the Detroit area in a senior living facility in Detroit that was situated really close proximity to both traffic and industry. This work was done in conjunction with Masako Morishita and Rob Brook. And what we did in that study was we conducted a randomized crossover trial of air purifiers. So basically, people were randomized to, well, they got both an active filtration and a sham, but they were randomized in terms of which order they would get them. The sham was basically an air purifier that looked just the same and sounded just the same, but we had taken out the filter from the inside. So we can really try and understand, right, like what are the impacts on exposure and health. So briefly, this is the data that we saw in terms of personal exposures and indoor exposures. We did see good evidence that both a low efficiency filter and a high efficiency filter both reduced exposures to people inside their homes, as well as like sort of blunted the variation or like kind of removed those higher peaks when there was filtration in the home. We also saw improvements in health. So we looked at blood pressure levels and saw that periods when they had filtration, people were, systematically clocking in with lower blood pressure levels as compared to times when they had a sham filter. We also did some additional adjustments. So even though it was random, we still adjusted for day of week and calendar time and temperature outside and ambient particles. All right, so that short little summary there, does provide evidence that individual interventions can also provide protection. Although when we're thinking about that pyramid, this is sort of an area where you have a less bang for the buck in terms of the population level change. So in summary of our findings, right, we found evidence that modifying the vehicle fleet and the way in which people commute should translate to tangible population benefits. We also saw evidence that, it may be efficient to intervene on select sources, and that may change depending on what your outcome is. But there might be these opportunities for selective interventions if we continue sort of this notion of what source might be contributing to health. And then finally, right, we saw that individual interventions can provide protection, though perhaps less effective than at population level. Oh my gosh, we have so many collaborators. I'm so grateful for the many, the many grants that we've had funded both by the NIH and the HEI, as well as my many collaborators. And I will just leave this one as the final slide. It's one of my favorite quotes these days. Action without science may be a waste of time. Science without action is merely a way to pass the time, but science with action can change the world. So with that, I thank you so much for your attention.
Great, thank you, Sarah. And oh, you just closed your presentation.
Yeah.
Okay.
Do you want me to
All
keep
right.
it open?
No, it's okay. So we have one comment by Stuart Betterman, Professor Betterman, and then so it's a long comment. It's not a question. So as I said, you can take a look, and then if you have any you wanna
Yeah. So
yeah.
he says he's dating himself in his prior life as a gearhead, which I love, Stuart. He remembers a couple of vehicles did not have positive crankcase ventilation, which solved the problem. Gas-powered vehicles became standard in the 60s and 70s, often problematic as the valves were not reliable. Problem did get solved, but diesel and heavy-duty vehicles got a pass. Yeah. And it's actually, I actually found it really fascinating to do this work because, sometimes there's unexpected results. We've been doing some work in the electric buses, for example, which I didn't talk about here, but in the very early versions of the electric vehicles, they didn't have a way to heat the bus because the engine block up front is usually how we heat the cabin. And so when you're in a cold climate like Michigan, you need a heater, and they were like putting on, unvented heaters on buses that were running on diesel. And so actually, like, there's sometimes these unanticipated consequences. Similarly, right, the biodiesel that I showed you in the Seattle, there was another retrofit, which was a diesel particulate filter. But sort of as Stuart is saying, they put those on initially, but they took them off in the end because they wound up getting clogged up and they weren't, they were basically breaking buses. And so, intervention research is important because it highlights, sort of these issues of what really works and what doesn't.
Okay, so so one question, it's interesting to see your international study of air pollution and cognition and Alzheimer's disease, and then between those two studies in US and India, consistent finding is that the more like a strong association were found in agricultural area.
It's fascinating.
Yeah.
Yeah.
I'm curious if this is some like a wildfire effect. So not only the low level cumulative exposure, but extremely high episodic exposure do something. And so do you have any idea I can comment?
So it's a great question. And what's cool about these data is we can actually break apart the agriculture from the forest fires. So the other burning and like open burning is the one that captures wildfires. And I didn't show it here, but Boya actually went and got an even more time resolved data set on wildfire smoke in the United States. And she still sees robust associations with the wildfire smoke. So, it's interesting, right? Because when we think about intervening, we think about regulations, like we are not thinking about those natural exposures. And quite frankly, agriculture, we've not been thinking as much about. But if you look at this original study that was done by McDuffie et al., they basically start to show that agriculture, I think, is an underappreciated contributor to our particle emissions and therefore the burden on health. So yeah, it looks to me like they're both there.
Okay, that's interesting finding. Yeah,
really
so I'm looking forward to the paper come out and then yeah. Okay, so then maybe I can ask one more question. And I always see very interesting your this intervention, the school bus study, and then one of the findings you show us today was that this counterfactual, study design, and then change it to electric vehicle, and then electric vehicle plus physical activity. So then, given the finding, we may expect, more benefit can happen if this intervention is done. A more polluted area, not only like a Seattle, even though there are some ambient the pollution, but like in China or in India and other South Asia country and South America country. And so then, but do you expect that this electric vehicle change plus physical activity can provide more benefit in more polluted area compared to US?
So there's lots of different layers to that question. I mean, one of the things that I always try and remind people of is electric vehicles. Switching to electric vehicles has great benefit if the energy you're using to electrify your vehicles is coming from a clean source, right? So like Julian Marshall out at UW did some really cool work a while back where he basically was showing that if your energy grid is relying on highly polluting sources, it may not be great to switch to electric vehicles because actually our cars are getting cleaner and cleaner and cleaner. So if you're just switching and trading it off, right, it might not be beneficial. So it's a complicated question on that part because it depends on where they're getting their energy from, right? We also have seen that for air pollution, the associations are not always linear. So at the highest, pollution zones, and this, right, thank you. Sometimes the change that you see is smaller, per unit change in air pollution than what you might see in a clean place. And so certainly in the most polluted places, we want to do everything right to like sort of push them over that edge so they can start seeing the huge benefits, but it is a little bit tricky.
Okay. All right. So now it's 12:52. So thank you, Sarah, for this excellent, the presentation. I always learn a lot when you give this, excellent presentation. So we look forward to more progress in your continuing study. So,
thank you.
And thank you everyone for attending this seminar. So we will have another seminar before end of this year in early December. So Meredith will circulate that new seminar. Okay, so then thank you and have a great day.